Hey, hello everybody. It's Dr. Alex Earle here at Pure Plastic Surgery, and it's Hump Day with Dr. Alex Earle. And today, I wasn't going to talk about this, but there's a report that came out very, very recently that I learned about yesterday, which I just felt like almost like shocked when I saw it. I think it's extremely important to share this along with all of you. Because it's a feeling that I had for several years about the fact that there were too many deaths from cosmetic surgery in the Dominican Republic. And it was just a feeling based on what I could see on the surgical blogs and whatnot. But here's the actual report of what's been going on in the Dominican Republic from 2009 to 2022, okay? And the scary part about all this is that you still have like surgical bloggers and people out there promoting, cosmetic surgery in the Dominican Republic when, they probably know that there's been so many deaths associated with cosmetic surgery out there. But this is actual data. This is not a feeling that we've been having. So a very serious topic here today, and I hope that you guys are paying attention, okay? But this is an official report from the CDC, okay? And this came out very recently, as you can see here, January 25th, 2024, so just a few days ago. And they were finally able to compile the data, okay, regarding the death toll in the Dominican Republic, specifically related to medical tourism, so U.S. citizens going to the Dominican Republic for cosmetic surgery, okay? And the data here is compiled from 2009 through 2022, but they actually have even more detailed data for some of the more recent years, 2019 to 2020, and they have autopsies reports from those years as well. Okay, but the shocking thing, the first thing that you need to know is the number of U.S. citizens that have passed away in the Dominican Republic from cosmetic surgery between 2009 and 2022 has been a total of 93 deaths in that span, okay? Not only that, but it's not getting better, it's actually getting worse, okay? So as you can see here, it says that the number of deaths went increased from a mean of 4 per year in the earlier years between 2009 to 2018 to a mean of 13 per year, okay, between 2019 and 2022, with a peak of 17 in a single year in 2020. That is outrageous, okay? That is something that should not be happening, okay? And so these are the actual numbers reported to the CDC. It might even be higher, but these are the ones that have been reported, okay? So let's delve into that a little bit, okay? Here is the grand total, as you can see here. So a total of 93 cosmetic surgery related deaths of U.S. citizens in the Dominican Republic occurred between those years, 2009 to 2022. Okay, there was mostly women except for one, so one male, okay, and the rest were all women. Of course, women are the ones that tend to get more of the cosmetic surgery, and they're also the ones that tend to travel outside of the U.S. more for cosmetic surgery, okay? And of course, they're all young. People that are getting cosmetic surgery are relatively young, so the mean age is 40, okay? And like I said, like it said there in the report, the deaths can vary depending on the year from like 0 to up to 17 in a single year, but it's actually getting worse. There used to be 4 deaths on average per year in the earlier years up to 2018, and then that jumped up to, to 13 deaths per year since 2019, okay? Now why is this happening? Why is this happening in the Dominican Republic, okay? Well, let's delve into that. What were some of the patient characteristics, and what are some of the procedures that are being done, okay? So the patient characteristics are that a lot of them, okay, were in the higher BMI range. So BMIs that say I typically wouldn't do here, they were being done in the Dominican Republic, which of course was also one of the things why women decide they go to the Dominican Republic, because here in the U.S. a lot of surgeons, including myself, would say no, you're not a surgical candidate, your BMI is too high, okay, and then rather than kind of take that advice and then go into a weight loss program, whether it's surgery or diet and exercise, they decide to look elsewhere for someone that will accept them, and unfortunately in the DR they've been accepted. And as you can see here, among those here, for the more specific data that they have, which are the 24 deaths between 2019 and 2020, okay, among those, 96%, right here, 96% were either overweight or obese. That means pretty much all of them, or the vast majority of them, were over a BMI limit. Okay, they're either overweight or obese. 96%. Okay, so that's something I think that we definitely have to keep in mind. It's not any safer if you go somewhere else to have your surgery. So if a surgeon here in the U.S. like myself is saying, hey, it is not safe to do your surgery, your BMI is too high, it doesn't mean that if you go to the DR or somewhere else, it's going to be safer. The same risks apply, and the chance of death and complications is higher. So that's why we have BMI limits to start with, okay? Because you want to minimize complication rates and want to optimize outcomes, okay? And now looking into the procedures, this is another thing that I try to talk about all the time, and sometimes the patients, again, they don't understand. But these were all 100% of the cases involve liposuction, okay? 100 of the cases involve liposuction, and 92% of these involve gluteal fat transfer. 92%, okay? So that means that the fat is being injected into or deep to the muscle, all right? Unlikely that, I don't know for sure, but unlikely that they're using ultrasound, because if they were using ultrasound, you'd be able to know exactly where that cannula is and that you are in that safe space, okay? Like we do here at Pure Plastic Surgery, all right? 92% gluteal fat transfer, all right? And here's the other kicker. This is what I talk about all the time. A mean of 3 procedures were performed in each person that passed away, okay? 3 procedures combined in one. That's one of the major draws to the Dominican Republic, okay? One of the major draws is they accept a higher BMI. The second major draw is that, is that they will do multiple procedures at once. They'll do like a mommy makeover with a BBL. They'll do breast, tummy, BBL, okay? Or combine, routinely combine tummy and BBL. Well, guess what? One of the reasons why I don't do that is because it increases your complication rate. All right, complications rate go up, death rates go up. All right, and all of these cases had more than one procedure being performed at that time, with an average of 3 procedures being done all at the same time. Okay, so let's take a look at some of the graphs here, which will really kind of paint the picture for you. All right, so this is in the Dominican Republic from 2009 to 2022. Okay, and these are the number of U.S. citizens that have passed away due to medical tourism for cosmetic surgery in the Dominican Republic. And you can see here that, 2009 to 2018, the average there was about 4 a year. Okay, and then right about COVID and after COVID, it took off to about 13 a year, with the worst year being 2020, where there were 17 deaths in that year alone. This should not be happening. Okay? Here we go into some of the demographics. Like you said, pretty much all of them were women except for one. Okay? And the BMIs were 96% had a BMI of overweight or obese, or BMI higher than 25. Okay? And the procedures are here. So all of them had some degree of liposuction. 92% had gluteal fat transfer, okay, combined with either tummy tuck or breast or some other procedure, okay. Most of the deaths happened within 24 hours or immediately, okay, and the others within the next few days, with an average of, between about 2 to 3 days after. Now here's the interesting thing: the cause of death. Cause of death was mainly either a fat embolism. Okay, that is a direct hit when you put the cannula into or deep to the muscle when you're doing gluteal fat transfer. That causes the fat embolism. Okay, and that happened in approximately 55% of the cases. All right, and most of the other causes were due to a blood clot. Okay, so pulmonary venous thromboembolism, or a PE, pulmonary embolism. Okay, and we all know that the risk for PE is higher when BMI is higher, when you combine different procedures, especially if you add a tummy tuck. Okay, when the length of the procedure, the longer the procedure goes, the higher the risk. Okay, so if you're doing a combined procedure, it's by definition going to be a longer procedure as well. All right, and that's what's causing these deaths. Okay, one of them was bleeding and the other one was infection. Only one for bleeding and only one for infection. Okay, so this, is the actual data. I just learned about this yesterday. The report is recent from January 25th, and it really puts, a number to what, just what we've been somewhat feeling through what we can see through social media and whatnot. And what I say is, obviously, the reasons these are happening is because they're accepting BMIs that are too high. They're likely not using ultrasound, okay, for the fat transfer and placing the fat into or deep to the muscle, whether it's on purpose or, inadvertently, okay? But, sometimes we get a lot of patients that are like, I want that super vixen look. I want everything done all at once. Well, that's what's going to put you at higher risk. You want the super vixen look. A lot of times, they may be putting the fat into the muscle on purpose. That's the only way you can achieve these super vixen looks in one round. Okay, and then combining all these other procedures on top of that increases the risk of both fat embolism and, blood clots, pulmonary embolism. Okay. So, and this goes back to many of the, if you want to call them rules that I have here at Pure Plastic Surgery. All right, so my max BMI is 30, okay? And I don't combine procedures. I get this question all the time: Doc, why can't I do my mommy makeover and BBL? Why, Dr. Earle, don't you do a tummy tuck and BBL, right? Why can't I get everything just done at once? Well, this is why. Okay, so I really hope we're able to drive the point home regarding all these things, and that you take your safety above everything else as your number one priority. All right, so very kind of heavy subject here today, but I did want to share that because I'm not sure how many people out there will get a report from the CDC to see these actual numbers. Okay, all right, and I'm willing to take any questions relating to this. Or anything else?
First and very important, Doc, what's BMI and what's your limit? It's a very often question.
So I'm sorry. Yes. So for those that are not, don't know exactly what it is. So the BMI stands for Body Mass Index. Okay. And so the Body Mass Index is essentially a comparison of your weight in accordance with your height. Okay. So the taller you are, for the same weight, you'll have a lower BMI, okay? But more importantly, BMI correlates with comorbidities and with complication rates. So the American Medical Association says that a normal BMI is somewhere between about 18 and 20. Mild overweight between 20 and 25, or I'm sorry, overweight is between 25 and 30. And then above 30 is what they consider obesity, and above 35 is morbid obesity. Okay? So that's kind of the range there. So what we do know is that especially after you get above a BMI of 30, that's when the rates really start to go up, right? So if you have a graph there, and you have, BMI and complications. Actually, let me do it the other way around. So we have BMI here and complications. So as the BMI starts to go up, the complications don't really go up that much, but once you start to hit about a BMI of 30, it starts to go up like this. Okay? And certainly after 35, it really shoots up. Okay? So in our practice here, we want to keep this in the flatter part of the curve, right? So my cutoff for BMI is 30. Okay? Why? Because I know once you start getting above 30, these complication rates start to shoot up. What complication rates are we talking about? Almost anything, but we're talking about wound breakdown. Okay, we're talking about skin necrosis. We're talking about problems, respiratory issues. Okay, and most importantly, the one that can really be, deadly. We're talking about blood clots, deep vein thrombosis, and pulmonary embolism.
Okay. I know you said do tummy tuck first, but can you explain why?
Right. So one of the things that I always continuously talk about is I don't combine tummy tuck. Okay. I don't combine tummy tuck and BBL for this very reason right here. Okay. And so I always recommend, okay, given the choice, that you should do your tummy tuck first. Okay. Tummy tuck will address excess skin, it will address weak muscles, and also diastasis or muscle separation. All these things are not addressed by liposuction. And, in order to have the best result, you want that skin to be as tight as possible. So I always recommend doing that tummy tuck first, getting rid of the excess skin, tightening up that abdominal wall, closing the muscle separation, so you can then be ready for your liposuction and fat transfer procedure. Okay? There are a few myths out there which I have not found to be true. One of the myths is that if you do your tummy tuck first, you won't have any fat left for your lipo and fat transfer. That is a myth, and it's wrong. I have never seen that. Never. 6 years, 8,000 cases, 3,000 BBLs, I've never seen it. Okay? So why is that? Because all we're doing is removing all that excess skin down here, but you still have, you have fat in your belly, you have fat in your flanks, you have fat in your back. We have plenty of fat to work with. All right? So please don't believe that. You'll have plenty of fat after your tummy tuck. All right? And it's a lot easier, to do it first, to really be able to stretch that skin down, really get a flat belly without any lumps or bumps. If you do it the other way around, okay, because that skin has a significant amount of laxity, okay, it makes the liposuction a lot more difficult. It makes it a bit more dangerous, okay. But worst of all, because when you have skin laxity, you have increased chance of fibrosis and also increased chance of areas that have inflammation and a lumpy, bumpy appearance. The problem is that when you then go back to try to do the tummy tuck second, it is a lot harder to pull that skin down now because it has scar tissue and inflammation, and a lot of the fibrosis is now present, and you can't take it away. So you end up still with a higher risk of having a lumpy, bumpy stomach if you do your tummy tuck afterwards. Okay. So again, don't combine the procedures for your safety, and do your tummy tuck first.
Okay. There's any special procedure with people that do keloid?
There's a special, there's a way to try to kind of treat the incisions and the scars afterwards to try to minimize that risk as best as possible, okay? But of course, nothing is 100% proof. But starting at 2 weeks after the procedure, I recommend using a silicone-based scar cream such as Silogen. You're going to use that twice a day for the first 3 months. Diligent, you got to be very diligent about it every single day. Okay? If you find that at any point during that time or later, the scar starts to become a bit raised, then I recommend an injection with a steroid called Kenalog. Okay? And the earlier you do that, the better, to prevent it from becoming a full-blown keloid.
How long do I need to be out of work for 360 lipo and maybe scar revision?
So if you do it, 360 lipo with a scar revision, well, it's going to depend a little bit on the work that you do, number one, right? So if you're, for example, someone that's very active during work, like our firefighters, right, or police, if you're a policeman or a policewoman, then for that type of work, you're probably going to need to take 6 weeks. Okay, even also maybe some of our nurses that are lifting patients and moving them around. Now, if you have more of an office type setting, okay, then after liposuctions, typically 1 week is enough. You can go back to the office. You can go back to driving typically after about a week as well.
If a patient's blood pressure is high on surgery day to nerves and the white coat syndrome, will it be canceled?
Depends on how high. Yeah. So for the most part, if your pressure is just higher than your normal pressure than your average, but it's still kind of within a reasonable range, then we won't cancel you. Okay. Now, if you show up, especially if you have a history of high blood pressure, and the blood pressure is very, very high, meaning that 180 or higher in the systolic and over 100 in the diastolic, then it's possible we may have to cancel until we get that pressure under control. Now on that subject, you can take for most patients, you should be able to take your blood pressure medication the same way you normally would, even if you have to be NPO before surgery, okay, with a small sip of water. All except for the medications that are called ACE inhibitors. For those that have ACE inhibitors, like those that have the lisinopril is a common one. Those patients you can take it the night before, but not the morning of surgery.
Okay. How many weeks can't you sit if you have a BBL?
So for me in my practice, I don't like our patients to sit directly on their buttock for the first 6 weeks. Okay. Now before then, you can use a special pillow. It's called a BBL pillow, and so it's a pillow that when you sit, it puts pressure here on the thighs. Okay, but it relieves the pressure off the backside. And so that's what you can use within the first 6 weeks, and after 6 weeks, you can sit normally.
Okie dokie. Do you perform arm and upper back lipo for that cohesive look?
For the what type of look?
Cohesive?
Cohesive.
Cohesive, yeah.
Of course. That's what it's all about. So we want to make sure that we have very smooth transitions, that everything looks like it belongs, like nothing is overdone or underdone, I guess, for that matter. But yes, definitely want to contour the back, want to contour the upper back, the bra line, also this area here underneath the armpit and the lateral breast. Okay, and for a lot of patients, I do recommend adding the arms, because if not, if you were to gain, if you have your lipo 360 and everything else, and you don't do the arms, and then in the future you start to gain weight, guess what? Guess where it's going to go first? To the areas you didn't do lipo. It's going to go to your arms, maybe your thighs, and things like that. So I think adding arms makes a lot of sense, but it is an add-on. Okay?
Okay. Is it best to lose weight before a tummy tuck to get a better, flatter result?
Definitely. So if you need to lose weight, you definitely want to do it before your tummy tuck, not after. Okay? So do the weight loss first. Get to a weight that you're happy with, to a stable weight, all right? And then go ahead and do the tummy tuck and maintain that stable weight afterwards, okay? But if you do it the other way around, if you do your tummy tuck and then you lose a significant amount of weight, well, your skin is going to get all loose again, okay?
Can you combine Lipo 360 and Lipo HD for better results?
Definitely, yes. So HD lipo can be combined with Lipo 360. It can be part of, say, for example, a total definer type of package that we have here, Pure, where you're not only, we're doing Lipo 360, we're doing the HD lipo, we're adding arms, we're adding thighs, chin, whatever it is that we need to do to get you that athletic look. And we're also adding skin tightening procedures such as Vaser, Body Tighten, Morpheus, okay? And all that stuff can be combined in the one surgery. Now, not everyone qualifies for HD lipo, okay? So that's something that you have to keep in mind. If you have loose skin, you're not going to qualify for HD lipo, okay? So if your BMI is too high, certainly above 25, you're typically not going to be a candidate for HD lipo. So most candidates have a BMI lower than 25, and they have good quality skin. Now, if you don't have good quality skin at that time, then what can you do first? What did we just talk about? Right?
Yeah.
You do your tummy tuck, make it good quality skin, right? We stretch it all out, we get it nice and tight. Now you have good quality skin. Come back and you can do your HC lipo.
So, do you recommend that lipo 360 1 year after a tummy tuck, or how long?
It doesn't even have to be that long. That's the great thing. So you can do your lipo 360 3 to 4 months after your tummy tuck. So you can get everything done within 1 year for sure. Okay, and that's the safest, most effective way of doing it for the best long-term results.
Okay, Doc, you're gonna like this question. What if we gain weight to be a candidate for a BBL, but having a tummy tuck first? How does the weight gain affect the tummy tuck procedure?
Okay, so here's the thing. So now we're talking about, typically this is going to be a skinny patient, right? So that needs to gain weight for the BBL. Okay, and they also, I guess, presumably have loose skin, right? So it's a combination there that it's a very specific combination. Now, so you're typically talking about someone that's, yeah, they have to gain weight, but we're not talking about they're gaining like pounds and pounds and pounds and pounds of weight, right? We're talking about someone that maybe weighs, say, 120 pounds and they go to 130. Well, that's going to be fine. It's going to give us enough fat for a BBL, but it's not going to really affect your tummy tuck, okay? So in that case, sure, gain the weight to get the 10 pounds or so that you need. I almost never ask anyone to gain more than that, okay? Unless they're really super skinny. And then you have your tummy tuck, and then 3 to 4 more months later, you got your lipo 360, potentially HT lipo, and your BBL. But here's what you have to know. That new weight, that new plus 10 pounds, whatever it is, 130 or 120, now you're 130, that's your new baseline weight. That's what you have to maintain those BBL results.
After Ozempic, I reached my goal BMI. So what's the difference between ab etching and stomach contouring?
Okay, so typically when you lose a significant amount of weight with Ozempic or any other form, okay, you develop a significant amount of loose skin. When the skin is loose, you can't do ab etching. So ab etching is simply etching out and breaking out that muscle with the use of liposuction, okay? But what you're going to need typically, if you lost a lot of weight with Ozempic, is an actual, body contouring where we're removing excess skin. Not only that, but we're actually tightening up the abdominal wall and typically fixing the diastasis too. So these are two different things. Now, the first step is to do the abdominal body contouring, okay, remove the excess skin, fix the abdominal wall, and then in some of those patients, it is potentially possible to come back 3 to 4 months later and do HT lipo.
Okay. I had a brachoplasty, but one arm always left with more skin.
Yeah, well, sometimes that can happen. No one is perfectly symmetrical from side to side, and you may not be perfectly symmetrical before or after surgery, but it should be a lot closer. But I would take that up with your surgeon. If sometimes you need to go in and kind of refine that first surgery and remove a little bit more skin from the one side, that's okay. Or sometimes maybe it's not so much that there's more skin on one side, but it has a little bit more, a little bit more fat. So maybe liposuction can help that side. So, it'd be something that would have to be truly evaluated to see exactly what would be the solution. But I think there could be some solutions to try to help and get the sides to be a little bit more similar.
Doc, last question. What's
your 30 minutes already?
Yes, sir.
Oh, we're not having
29 minutes, 20 seconds, and the last question.
All right.
Okay, what's the range for the hemoglobin?
So what's the range for the hemoglobin? Okay,
yes.
So this also depends a little bit on the procedure that you're going to have, okay? But the one where we really need the hemoglobin to be a bit higher is for your lipo 360s and your BBLs, okay? So the lowest hemoglobin you can have in order to even qualify for that procedure is 11, okay? And with 11, we're going to be using the Cell Saver for sure. We use the Cell Saver for all our patients. but definitely, for those with 11 for sure. I may not be as aggressive with the lipo. Those patients, if they start to show some degree of blood loss. Now, what are things that can help? Well, of course, before surgery, we always ask all of our patients to take vitamin C, folic acid, and iron supplementation to see if we can get that 11 to come up. And I also highly recommend for those patients to add Vaser to their liposuction procedure, because what the Vaser does is that it uses ultrasound energy to, what the technical term is emulsify, but to release the fat cells, which then makes it easier to remove the fat cells, and therefore it's done in a way where there's less blood loss, less trauma, and less inflammation. So I would highly recommend that. All right, but any hemoglobin above 11 is satisfactory for lipo-316 BBL or mommy makeover or most other procedures. If you're doing a strict breast procedure, say you're coming in for a breast dog, we can accept even a little bit lower, up to 10, because that is a procedure where it's a tiny incision and there's minimal to no blood loss. All right, is that it? Okay, so I just want to, point this out once again when we started talking here today, okay? Don't go somewhere simply because they accept your higher BMI if you're not under BMI, okay? Don't go somewhere where you're combining multiple procedures, all right? At the end of the day, it's not worth it, all right? Go somewhere where they have your safety as a number one priority, okay? All right, well, I look forward to seeing all of you next week on Hump Day with Dr. Alex Earle. Ciao.